everyone, welcome back to the Tox Lab. I'm Rebecca.
I'm Rob. This week we're going to be looking at Delta-8 THC, which is a cousin of more familiar Delta-9 THC. There's not a lot between Delta-8 and Delta-9 chemically, is there? Only a double bond.
Mm-hmm.
What's your favourite double bond?
I don't think I have a favourite double bond.
Completely reasonable.
I'm nerdy, but I'm not that nerdy.
The position of double bonds in molecules is a bit like the positions of commas in sentences, isn't it?
Mm.
It can completely change the meaning of a chemical by moving a double bond, in the same way that let's eat granny versus let's eat granny are two different sentences.
Before we jump into today's episode, I just want to thank all of you for listening. We've recently hit 1,000 plays on the podcast, so we're really grateful for anyone who's listened, shared, liked, followed. It means the world to us, it really does. If you want to keep up to date with our latest episodes, you can find us on socials. So you can find us on Instagram at _tox_lab. We also have a LinkedIn page. And for those of you who don't use social media but want to get in touch with either feedback or suggestions for future episodes, you can email us at thetoxlab@gmail.com. And these details are in the description below.
So what is Delta-8 and how does it compare to Delta-9? Historically, cannabis used to be simple, didn't it? It used to be a psychoactive plant that had an amount of Delta-9 THC, and it contained a whole host of other cannabinoids, but not a lot was known about them, and in general, people didn't really seem to care. And then, more recently, we've had movements towards CBD farming and CBD products, so cannabidiol is another cannabinoid. And then from there, we've seen this rise of semi-synthetic cannabinoids, so compounds that are chemically altered versions, usually of CBD. And we've talked about this before, haven't we? I think we've mentioned it a couple of times on various episodes about semi-synthetic cannabinoids. And Delta-8 is essentially one of those. It does occur naturally in very low concentrations, actually, in cannabis plants. It has been detected. But more often than not, it's being seen through the chemical alteration of CBD. Chemically, it's an isomer of THC. The only difference is that the double bond is in a different place. So this week we're going to look at a couple of papers. One is a controlled study of Delta-8 and one is a clinical case report. Rebecca, why don't you dive in with the first paper?
So this study looks to compare the acute effects of Delta-8 THC versus Delta-9 in healthy adults who infrequently use cannabis. This group looked at both oral ingestion and vaporised routes, but the paper we're going to talk about today is their oral ingestion. So they recruited 18 to 45-year-olds who were in general good health, who had negative drug and alcohol screens before each session, and admitted to using cannabis within the last 2 years, but not within the last 30 days. They underwent 5 outpatient experiment sessions where they orally self-administered either a placebo or 10 milligrams, 20 milligrams, or 40 milligrams of Delta-8 THC, or 20 milligrams of Delta-9. And these sessions were spaced 1 week apart and the order was randomised, so no one knew what they were getting at the time. At the beginning of each session, participants were given a low-fat breakfast, such as toast and jam. Then they had a catheter placed in their forearm vein for repeat blood collections, and they completed a load of baseline assessments. So this included a blood draw, a drug effect questionnaire, vital signs measured, and they underwent tests to assess their cognitive and psychomotor performance. Then this bit made me chuckle. I'm not entirely sure why, but it was really funny that they then gave each participant a Betty Crocker fudge brownie mix brownie that had the measured dose of THC in it.
Shout out to Betty Crocker.
I mean, it's a great brownie mix. If anyone's not tried it, I highly recommend if you're like in a pinch and just really fancy some brownies, because they are really, really good.
Sponsorship positions are available.
And then after this, they had bloods and repeated these tests at set time points. So a little look at the tests they were conducting. They all participated in a drug effect questionnaire where individuals answered between 0 and 100, so not at all to extremely, on questions related to the overall magnitude of effects, so how the drug made them feel, positive effects, negative effects, and then perceived impairment. Then they underwent 4 different tests to assess psychomotor performance, working memory, divided attention, and global impairment. This also covered balance and reaction time and higher order cognition. And heart rate and blood pressure were also monitored. So 19 individuals took part in this study, 12 men and 7 women. Average age was 28 years and the average weight was 79 kilograms. And 67 days on average had passed since their last cannabis use. It's important to mention that 6 adverse events, rated mild to moderate, were found in this study. 2 individuals found the IV catheter uncomfortable. Nausea and dizziness was reported in 2 after ingesting Delta-9. Dizziness and headache was reported with placebo in 1 individual, and lightheaded and dizziness was reported at a 10 milligram Delta-8 dose.
Hard to read very much into that, isn't it? Given that the placebo and the Delta-9 group all seem to have similar experiences.
Yeah, exactly. And they all resolved with very minimal treatment. No one dropped out of the study as a result of these adverse effects, but it's important to mention. So with both Delta-8 and Delta-9 THC, concentrations peaked in both parent drug and metabolite between 2 and 4 hours after ingestion and steadily decreased over 4 hours. When looking at ratios of parent drug to metabolite, the ratio of Delta-8 to hydroxy Delta-8 was higher than with Delta-9 and its hydroxy metabolite. But the reverse was found when looking at the carboxy metabolite. So there was a lower ratio of Delta-8 to carboxy than with Delta-9.
That's interesting. So that does suggest some differences in metabolism of Delta-8 versus Delta-9. Although they seem to follow the same metabolic pathways, perhaps they've got a preference of one over the other. Interesting.
So with a 40 milligram dose of Delta-8 and a 20 milligram dose of Delta-9, subjective ratings of drug effect, misuse liability, and common sensory effects associated with acute exposure were all high. At 20 milligrams of Delta-9, there were higher subjective ratings for drug effect, and they describe these as feeling high, anxious, nervous, and dry mouth compared with any of the Delta-8 doses. And interestingly, they saw no significant differences between the 40 milligram Delta-8 dose and the 20 milligram Delta-9 dose, or the 10 milligrams of Delta-8 and the placebo.
Okay, so 10 milligrams possibly wasn't doing very much, but it was dose dependent within the Delta-8 group beyond that.
Yes.
40 was considered stronger than 20.
Yep. In the psychomotor tests, 40 milligrams of Delta-8 and 20 milligrams of Delta-9 THC both showed a low number of correct responses on tests associated with psychomotor performance, and heart rate was significantly elevated in both the 40 milligram Delta-8 group and the 20 milligram Delta-9 group relative to placebo. And what was also interesting was with a 20 milligram dose of Delta-9, the heart rate increased more than both the 10 and 20 milligrams of Delta-8. So it kind of suggests, and their conclusion for this paper was that Delta-9 is more potent than Delta-8.
So at least looking at oral ingestion, it looks like Delta-8 is probably a bit less potent than Delta-9 in terms of drug impairing effects. Not a lot more we can say, is there? Relatively small study, although I think quite well performed, to be fair.
It was. They do mention that with the study, they couldn't detect differences in sex and other factors associated with the individuals just because of how small their population was. And they were also only looking at a single edible formulation. So things like gummies or drinks and things like that might have different effects versus THC baked into a brownie.
Yeah. And crucially as well, this was effectively pharmaceutical grade Delta-8 THC.
Yes, they also mentioned that there was no CBD or things in there that could cause any other interactions. So that all plays a role when looking at this.
All right, so let's now move on to the case report.
So a previously healthy 2-year-old girl was transferred via air ambulance after being found with reduced responsiveness and sedated after reports of CBD edible ingestion. 45 minutes prior to arrival at her local hospital, she was found with a GCS of 3 and was minimally responsive to stimuli. She was 15.3 kilos, had a heart rate of 136 beats per minute, and her O2 saturation was 98%. Due to the acute encephalopathy and concerns about protecting her airway, she was intubated using ketamine and fentanyl. After arriving in hospital, she remained minimally responsive, but with spontaneous eye-opening and upper extremity movement. And she was given dexmedetomidine drip for light station and was admitted to the pediatric ICU.
So this is quite a textbook clinical presentation of cannabis ingestion, isn't it, in children? A loss of consciousness, but actually not a collapse of respiration, which is actually fairly unusual.
So after speaking with the family, it turned out that the father had purchased Delta-8 THC gummies from a local gas station, and the packet contained 12 gummies, each with a dose of 25 milligrams of Delta-8 THC. They found their daughter behaving oddly and lethargic, and then came across the open packet, which was empty, and 3 of the gummies were spilled on the floor. So they assumed that she had ingested the other 9 gummies, which equals a dose of 225 milligrams of Delta-8 THC, which is 14.7 mg per kilo. So quite a decent dose.
So let's compare that quickly to the previous study. The last study, they were ingesting a maximum of 40.
Yeah.
And 2-year-olds are quite a bit smaller than adults.
Mm-hmm. So they sent samples for toxicology, and the samples were screened using an enzyme-linked immunoassay of the urine sample, which was positive for cannabinoids and fentanyl, which isn't surprising because fentanyl was given. LCMS was reflex based on this, and fentanyl was found at a concentration of 5 nanograms per mil, and the carboxy THC was greater than 400 nanograms per mil. Samples were also tested via GCMS, which detected ketamine, fentanyl, and cannabinoids. And I don't think in this lab they were able to differentiate between Delta-9 and Delta-8 THC. So samples were sent to the DEA toxicology testing program, where they use LC-QTOF-MS, and confirmed the presence of Delta-8 but no Delta-9. In plasma, the Delta-8 concentration was 107.6 nanograms per mil, and the carboxy THC was present at 746.5 nanograms per mil. And in urine, that carboxy was present at 1,550 nanograms per mil.
It's all fairly high. Let's drill into the testing aspects of Delta-8 versus 9 for a moment, because I think this is quite an important area. Really, there's 2 ways of testing for cannabis exposure, isn't there? Either immunoassay, which detects the presence of a compound with the shape, like Delta-9 THC, or you've got mass spec, which measures the mass of the compounds. And both are going to be affected by Delta-8 in different ways, aren't they? Delta-8, as we said at the start, there's only a very slight difference. A double bond is moved. If you're using immunoassay, as they were initially as the screen in this hospital, you might get some cross-reactivity, but I don't think we really know how much cross-reactivity you get. It may not be like for like the same as Delta-9. So if you're using cutoffs and things like that, there's a chance that your screen is either going to miss it or overestimate it. Conversely, if you're doing mass spec analysis, because Delta-8 and Delta-9 have got an identical mass, it really is going to depend on your chromatography. If your chromatography doesn't separate them, you may not know the difference. If it does separate them and you're using automated peak integration and things like that, the software might not even see the peak. You might not even get a positive hit on your mass spec. So I do think that expanding our testing to make sure we're covering Delta-8 actually is something that labs do need to be thinking about.
So luckily the story has a happy ending. She was extubated 10 hours after her admission to the pediatric ICU, was monitored for 24 hours, and her GCS had returned to normal, and any mental impairment had resolved 24 hours later.
So you mentioned there, Rebecca, that this was purchased at a gas station. This is a US case report.
Mm-hmm.
What's the legal situation in the US? This is definitely a loaded question.
So in 2018, US Congress passed the Agricultural Improvement Act, also known as the Farm Bill, which removed hemp and its derivatives, which was defined as cannabis containing less than 0.3% Delta-9 THC, from being a controlled substance. So Delta-8 was then legal, and then we saw an increase in its use. In 2023, there was a national survey of 12th graders, so these are children aged between 17 and 18, and 11.4% of them had admitted using Delta-8 in the last year. And this was either for recreational use, to self-treat conditions such as depression, insomnia, or pain relief, and there were legal advantages over using traditional Delta-9 THC.
I'm not a legal scholar, and I'm definitely not a legal scholar of US cannabis law.
Mm-hmm.
I think it varies by state as well, doesn't it?
It does, which just makes the whole thing a lot more complicated.
At least in certain states, due to these legal changes, there has been this rise, hasn't there, of semi-synthetic cannabinoids. They're not Delta-9, therefore they're not controlled. We spoke a few weeks ago, didn't we, about mitragynine products being sold freely, and some of these Delta-8 products, it's very similar, isn't it?
Mm-hmm.
The presence of gummies and edibles and vape cartridges, and yet clearly, quite psychoactive. And in the case of this case presentation, actually could potentially have caused harm. Gummies in particular are a problem for children, aren't they? Because they look just like sweets.
Yeah. I think it just highlights the dangers of having recreational drugs in these sorts of formats and the importance of just keeping them out of the way. I think he'd just thrown them on the table without a second thought. But a 2-year-old's going to see a packet of sweets and want to open them and give them a try.
Potentially even with a child-proof cap. I know from my experience, child-proof caps are not child-proof. The legal landscape in the UK is very different, isn't it? Delta-8 is officially controlled under the Misuse of Drugs Act as a positional isomer of Delta-9. We do still see it though, don't we? It is still listed for sale on certain websites claiming to be able to ship. We do still see occasional American imports making it through border onto the street. And it is increasingly, I think, making cannabis testing more complicated, for sure. I think the picture across Europe is very similar as well. Some countries have outright banned it, others are stuck in this sort of legal grey zone. So what do we think? Do we think that Delta-8 is mild to Delta-9? Is that our conclusion?
Potentially, at least as far as oral ingestion is concerned. The group that we looked at the beginning, who looked at Delta-8 and Delta-9 ingestion in brownies, also looked at the differences between vaporising Delta-8 and Delta-9. And when you vaporise it, Delta-8 elicits a comparable psychoactive effect as Delta-9. And considering we believe that Delta-8 is slightly less potent, this might be just due to differences in routes of ingestion.
Okay, so it's possible that the first study then, actually, the difference between Delta-8 and Delta-9 was more to do with its absorption and metabolism potentially, rather than necessarily it being less psychoactive. It's certainly marketed as being a milder version. If you look at the various websites selling Delta-8, they do claim that it is milder than Delta-9. It's maybe entirely subjective. Maybe we need more research.
And interestingly, both with the oral ingestion study and the vaporized study, there was less psychoactive 11-hydroxymetabolite of Delta-8 present in comparison to Delta-9. So I don't know whether that might help to account for the differences in psychoactivity.
Differences in metabolism of the two compounds might influence it a bit. That's a good point. It's clearly not a safe compound, though, is it? I mean, look at that case report. And as I say, that presentation really was classic cannabis ingestion in a child, except it wasn't traditional Delta-9, it was Delta-8.
Yeah.
I think this is where the testing thing does worry me a bit. We do need to make sure that we are able to test for it. If Delta-8 and Delta-9 do have different potencies, we do need to be able to tell them apart in order to have any hope of actually interpreting some of this. There's going to be big implications for other areas as well, isn't there? Outside of clinical toxicology like this, road impairment, driving under the influence and drug cut-offs. The Section 5A legislation specifies Delta-9, not Delta-8. There's a lot of legal catching up that needs to be done, and also labs do need to be picking this up. Another thought I have got with this, if Delta-8 is actually milder than Delta-9, are users just going to take more of it to get the same sort of effect that they're used to?
Possibly. If they're after that classical Delta-9 effect, then they are going to keep redosing until they get there.
We're in sort of a weird place ethically, aren't we? Not so much us as toxicologists, but the whole market in general. You've got a drug which is really well studied but controlled, Delta-9, and then you've got a completely untested version that has similar effects, and that's being sold completely legally, despite the fact there's been no testing or very limited research. It's a very, very odd situation to be in. We would really like to hear from some of our colleagues in the US, actually, as to how they're dealing with this, because they're going to be seeing a lot more of it than we are over here. So let's look at the public health implications. Who's most at risk here?
I mean, arguably, if Delta-8 is less potent and there is less risk associated with it, although we don't know because it's not been as thoroughly tested as Delta-9, it might be a better alternative. But as of yet, we just don't know. It's
really an unknown, isn't it? Your facts about how many teenagers had used Delta-8, my perspective is that there is a perception that legal or uncontrolled equals safe. And clearly There needs to be some balance, doesn't there? What's next? I guess that's the question, as always.
It's a good question. I mean, I imagine at some point the UK will follow the US trend and we might start seeing more Delta-8 versus Delta-9 if we can test for it and labs are looking for it.
Yeah, it's tricky, isn't it? I don't think Delta-8's going away. I think that the cannabis landscape is only going to get more complicated. We've mentioned on here before about semi-synthetic cannabinoids like hexahydrocannabinol. They're making this whole thing even more complicated because all of the logic we've just applied to Delta-8 and Delta-9 in terms of testing. Again, same, if you're using immunoassay screening, you might not pick these compounds up, or you might, but we don't know to what extent. And if you're using a mass spec, you need to make sure you're looking for it on your mass spec. I think really the whole cannabis landscape has just got so much more complicated in the last few years, hasn't it? Really, we've gone from
cannabis being cannabis.
Cannabis being cannabis. Cannabis coming in two flavours, weed and hash. And now it's everything in between and you've no idea what actual cannabinoids are in there. Okay, so in conclusion, cannabis has become more complicated. The presence of Delta-8 is starting to emerge in clinical toxicology, and we're really just scratching the surface of what we really know about some of these newer compounds, these newer cannabinoids. So I think we're going to wrap it up here. I hope you've enjoyed listening to us this week. Do remember to like, follow, comment on our posts. That would be great.
So you can find us on Instagram at _tox_lab. We also have a page on LinkedIn. For those of you who don't use socials but want to get in touch anyway, you can email us at thetoxlab@gmail.com. All the papers we've discussed today will be linked in the episode description below if you want to give them a read and check them out for yourselves. And again, a huge thank you to all of our listeners. We're really grateful to each and every one of you for tuning in each and every week. Hope you all have an amazing week, and we'll see you next time. Bye!